I'm in the accelerated program and started last summer with the class you're taking with 103. And my experience being a male nursing student has been very positive so far. Our cohort is 25% men, which is fairly high for what my understanding of the profession is. I think we're up to maybe 12% perhaps in the workforce at the minute. So. What that says to me is that the future of men in nursing is going up, basically. You know, like the cohort that's graduating this December with us, we're going to be making up a higher percentage of the.
I'm in the 300 level.
Okay.
We have one more after this term, one more 300 level class.
I have been a pediatric nurse for about 5.5 years. I originally started in Cincinnati Children's Hospital. I worked in the cardiac intensive care, and then I was their charge nurse on their cardiac step-down unit. After I got enough experience and took a lot of tests that were unfun and got enough qualifications, I became a traveling nurse, a pediatric traveling nurse.
No, but it's been interesting. I've seen in a clinical that I'm in right now, for instance, one of the patient's family, as soon as I came in the room, the nurse was sitting talking with him, and as soon as I came in, he started directing more of his communications towards me as if I was maybe ranked above her or something, you know. I took it to be because I was male, because I might be wrong about that. That might be just my perception, but he was definitely directing his communication to me for whatever his reasons were as soon as I came in the room. Yeah. And he did, I was talking with him later, and he was relating some things, and it was the family member he was talking about. And he was saying, yeah, he's like you know, he's a doctor.
You know, there's a few kind of stereotypes about workforce issues with men in nursing, but having not been in the workforce yet, I can't say for sure whether those are true or not. But you know, the two that I know of as sort of rumors, I guess we could call them, would be that men get called upon to use their physical strength, say for transfers and things like that. So on the one hand, that's kind of exciting to be the center of attention, the person someone always goes to. But on the negative side, it's like, well, of course, you know, I also have brains and caring personality, so those things are you know, need to be used too, basically, to have a fulfilling work life.
In a population that is not educated in the medical field, is that male nurses are all gay. That is something, and not that it is offensive, but it's just kind of how it is. When I find that a lot of stereotypes, obviously, are going to come from people who don't have a lot of education into what we do. That's just how stereotypes are originally created to begin with.
Is that men are not quite so much victims of lateral violence in the workforce, and it seems the stereotype seems to be that men are not involved in it. You know, they're not kind of part of the ganging up on someone mentality, but also that they're not victims either, that people don't pick on them as much. You know, the kind of the journal article is, you know, why nurses eat their young, you know, and so hopefully we're not victims of that. So that's another stereotype that could be a positive one, in my opinion, but we'll see how that works out when I'm actually in the workforce.
Sure.
Every once in a while, someone will say, you know, that's sort of typical, why are you stopping at, you know, being a nurse? Why don't you want to be a doctor? I do get that every once in a while, yeah, but more often than not, it's just a real positive response.
The disadvantages are are being amazingly outnumbered. Currently, what I mean by that is I am the only male who works on my floor.
Well, the one clinical course that's been difficult was 318, which is maternal health. So I was at Providence St. Vincent's on labor and delivery, and then postpartum, and that in itself was not terribly difficult, but what is sometimes is seeking clients' permission to be with them. Some clients don't care, but some do. some don't want a male nursing student, and some don't want a nursing student at all. But yeah, so that's one problem, really. You know, that
Colleges, and it's just the reality that colleges all across America, especially in the East Coast, are very much looking for male nurses. Males in nursing have not really come to the forefront until very recently. I think honestly the current statistics are 6% of men, or out of the whole nursing world, 6% are men. But advantages of being a male nurse in a pediatric setting is the fact that children, for some reason, really, it sparks their attention when they see a 6'4" guy enter the room.
In fact, sometimes I think people appreciate having a male. That's kind of been my experience. Mm-hmm. There's just, and not that any of the nurses are anti-women, or I'm not trying to say that they think that the males are better at it. Or it's just a different sort of mindset sometimes, a different